بسم الله الرحمن الرحيم. Uh, we'll start now our meeting about the
Recording in
using of
progress.
ChatGPT in our clinical practice. Um, Let me start first by sharing my screen. Today we discuss how to use the ChatGPT in our clinical practice, in clinical research, and in education. Actually, this is يعني three topics, but we will try to summarize all these three topics in one presentation. So we start by what's meant by ChatGPT. The ChatGPT is what's called generative pre-trained transformer. This is the acronym of the ChatGPT. This is actually a large language model trained on massive amount of the text, interact with the users in conversation style. It can learn and improve its output, and actually it generates response to specific prompts. And this is the key for conversation with the ChatGPT, the prompts. So how do we interact with the ChatGPT? Actually, the ChatGPT, we interact with the ChatGPT by prompts. Prompts is some sort of questions or instructions that we give to the AI to elicit a specific response. This is what's meant by prompts. But to chat with the artificial intelligence, we need to have some idea about the ideal framework of the prompts. First of all, the prompts we have to tell the AI what is actually the personality that he need to or it need to play with. For example, we can ask the ChatGPT as a consider yourself as a cardiologist, consider yourself as a statistician, consider yourself as a researcher or reviewer. So you have to tell that ChatGPT what he is actually. He is a cardiologist, he is intensivist, or an anesthesiologist, he's a statistician, he's a research reviewer. Then tell GPT who you are. I'm a resident, I'm a physician, I'm a researcher, I'm a CEO. Then you have some sort of that you introduce yourself to that chat GPT. The third part, how can the GPT help you? This is the third part for the framework. I want to understand, to analyze, to create this an action verb to tell the GPT what you want from the chat GPT. The fourth thing, details with your subjects. Discuss the details with your subjects. The final thing, in what form you need the output. I need the output in the form of the bullet, in the form of the table, in the form of the infographics or image. This is the framework of the prompts, of the ideal prompt to get the ideal response from the chat GPT. We'll start by the use of the ChatGPT in clinical practice. How can you help me in clinical practice? This is a lot of things that can use the ChatGPT in our daily clinical practice. First of all, I want you to summarize evidence or best practice. This is one of the forms that the ChatGPT can help us that summarize the evidence or summarize the guidelines. For example, I am a resident, and I want you to summarize the main point of 2022 of European Society of Cardiology guideline on cardiovascular assessment and management of patient undergoing cardiac surgery. Let us see what is the response of the ChatGPT for these prompts. We'll start by putting this in the ChatGPT. Then we'll see what is the response. Here, the ChatGPT start by summarizing the guidelines in the few points. It started by the clinical assessment, preoperative assessment, general strategy, and so on and so forth. Then we ask the ChatGPT to tabulate this response, to produce this response in the form of the table. So he'll start by putting the response in the form of the table and hidden line. For example, introduction, clinical risk evaluation, assessment, and general risk factor. This is the one form. How can I ask the ChatGPT to change the output of the response from the bullet to the table? This is the first thing. The second thing for ChatGPT, how can I make it use? He can help me in taking a decision in my patient, like some sort of the clinical decision support. For example, if you consider yourself as an expert cardiologist consultant, and I'm a resident, and I want you to help me in assessment of 55 years old male patients with previous history of ischemic heart disease on the aspirin and the Plavix, diabetic on insulin, hypertensive, normal renal function, and he's going to do abdominal colectomy. The patient can climb 2 flights of the stairs. I want to assess the risk scores, any need of further testing, biomarkers, and whether he is clear for surgery or not, and shall we stop antiplatelet or not. Use the previous attached or previous 2022 European Society Cardiology guideline to post your response. Here is the more you have and some details of your case, the more the accurate or precise the response from the ChatGPT. To the response when I post this to the ChatGPT. First of all, I will ask him to what is the response for these cases. First of all, he started by systematically analyzing the case. The page is 55, the medical history as I posted. The functional capacity, I asked the ChatGPT, the patient's climb 2 flights of the stairs, and he translate this is the patient has moderate to good functional capacity. Then he start to calculating the risk score. And the risk score in the guideline is revised cardiac risk index. So he got the information from the data that I put it in the chat, and then he started to calculate the revised cardiac risk index, and he found that we have these 3 points. This the interpretation of this score that the patient is intermediate risk for cardiac surgery. Does the patient need for further testing? He claimed that the patients can climb 2 flights of the stairs, so he doesn't need any further testing. According to the guideline, this patient may need some sort of biomarker like globin B or troponin, and for medication, he start to have a medication what will be stopped like an Plavix. So the final recommendation, the functional capacity, risk score, further testing, biomarkers, and anti-medication management. So he actually analyzing the case, putting the case into referring to the guideline and starting to make some sort of stratification of the cases, calculating the risk score, and start to suggesting what we should do for this patient. This is example how the ChatGPT can work with the like a clinical decision support for consulting a case. That part, sometimes the ChatGPT can act to interpret some sort of test result. For example, if I have some this of the blood gases, so and I ask the ChatGPT, can you analyze the attached arterial blood gases and assess if there is any compensation or combined pathology and assess the gap ratio? So I asked the ChatGPT to analyze the blood gases and make some sort of analysis of the whether there is combined pathology or measuring the gap ratio. What will happen if we post these prompts? If you look to this, first of all, we attach the plugins. First of all, the ChatGPT 4 only can allow for attachment, but the ChatGPT 3.5 does not have this function. So we will attach the plug gases, and then the ChatGPT started to read these plug gases and interpreting the results like the pH, CO2, and bicarb. Then we check for compensation, then assess for additional pathology, then assess the gap ratio, and then he posts the final diagnosis or interpretation of these results. So this patient has a primary respiratory alkalosis, high anion gap, and actually has a mixed metabolic alkalosis. This is actually correct for interpretation of such a blood gases. Another example of how can the ChatGPT can read the results. So if we see this type of table that's behaving some antibiotics and this culture sensitivity for the E. coli, and here is the MIC for each antibiotics. And start by asking the ChatGPT, can you analyze the attached antibiotic susceptibility for the E. coli and select the best antibiotic to use? It is some sort of the cultural sensitivity with MIC with the mean inhibitor concentration, and we ask the ChatGPT to analyze this result. If you look to this, the output of these results, the ChatGPT started to the breakdown, read this image as an numbers. Here's repeating this number, the MIC that in the table. Then the ChatGPT, based on the MIC, the best antibiotic of the choice is these types of antibiotics: imipenem, ertapenem, gagetamycin, and topramycin. Then I will ask the ChatGPT select the best antibiotic based on the lowest MIC relative to established susceptibility breakpoint for each antibiotic according to the EUCAST. EUCAST is the one of the standard that for antibiotics, a breakpoint to tell us what is the sensitive and what is the resistant. Then we post this again, and the ChatGPT started to analyzing the MIC. When you have analyzing the MIC according to the breakpoint, this is the EUCAST breakpoint, and this is the MIC of the antibiotics. Then the ChatGPT start to calculate what's called the ratio to see what is the lowest ratio that can of the MIC relative to the breakpoint. And according to the lowest ratio, the ChatGPT posts what is the best antibiotics for according to the MIC. So the antibiotic with the lowest ratio is imipenem, followed by nitrofurantoin, followed by piperacillin tazobactam. So in the imipenem is the best antibiotic according to this result. One of the tasks that can be used during clinical practice the ChatGPT can help in writing a progress notes or transfer summary. This is very interesting. That's if you have progress note like this, we have some notes each day 1, day 2, and day 3. Then I try to actually combine all these notes in one paragraph. So first of all, we ask the ChatGPT draft the following progress notes for patient admitted with septic shock. Write the response in one paragraph and do not exceed 150 words. This is very nice that you tell the ChatGPT how much how many words that you want to your response. Here we ask the ChatGPT you should not exceed 150 words. Keep in mind that during posting this to the ChatGPT, don't share any types of patient data. So this data should be anonymously without any patient identification because the ChatGPT can share your data with others. So when try to summarize any type of the medical data from any patient, remove the name of the patient or any identifier for the patient and just put the clinical data to get the summary. Here is the example for the response. How can this can happen? First of all, we'll put this in a draft. Then the ChatGPT will try to making this is in one paragraph. The patient is 25 years old. I'm sorry. Here, the response patient is 25 years old, admitted on the 1st of the July with septic shock, presented with heart rate 140 and the blood pressure 70/40. On day 1, the patient received 2 liters of the saline and norepinephrine 0.2 microgram per kilogram per minute. By day 2, the heart rate was improved. Here, so the ChatGPT in the original progress notes, we did not write that the heart rate is improved. We just write the heart rate. But the ChatGPT can translate the first heart rate from 140 that decreased to 102 beat per minute, and then he stated that the heart rate is improved. So he can translate the vital sign, whether it's improved or it got worse. Then the blood pressure is 110/60, and he started to mention all types of the details in one paragraph, so he can summarize and remove the redundancy from any progress notes. This is the first part, that how the ChatGPT can help us in the clinical practice. The second part, how can the ChatGPT help me in research? Actually, if we start by the concept of the research started by the research idea, the introduction, the methodology. The methodology, should you mention the study design, sampling, measurement, and data collection, result, and discussion. And actually, the ChatGPT can help you in all these stages of the research. First of all, the research idea. How can the ChatGPT help you in research idea? Try do this hypothetical example. I'm talking to the ChatGPT. I'm thinking to do a research in presepsin, which is a new biomarker in sepsis diagnosis, and I need your assistance to provide me with 3 research ideas in this subject. In your response, provide the research questions proposed and the study design. And we will start by posting this prompt and see what is the response. I start by tell me that the research idea number one is the diagnostic accuracy of the presepsin in early sepsis diagnosis, and he posted the research question, and he suggests study design is prospective cohort study design. Then we start by example the number two, the research idea number two is the presepsin as a diagnostic tool for start by as a for outcome like mortality, and start by take the study design and suggest some methodology. Then presepsin as a kinetic in sepsis and sepsis, this is the third research idea, and so on and so forth. Then this is the how can the ChatGPT can suggest some idea for research. But very important, when I start by suggesting some research idea, I need to search about this idea. So how can the ChatGPT search the internet for published data or not? If we look to the ChatGPT, which is free version, is 3.5, when I ask him, can you browse the internet in real time? The answer is no. I don't have a real-time browsing capability, but I can provide information until the January 2022. But if you subscribe to the ChatGPT 4, can you provide the internet real time? Yes, I can provide the internet in the real time. So if I didn't have ChatGPT 4, you may search by using either Google's or Copilot. And I got some comparison between the Google search and the ChatGPT search. What is the difference between the two types of the search? Google search as a functionality is the search engine for web content, while the ChatGPT is the artificial intelligence human-like conversational model for text response. In the memory of the Google, it's short and long-term memory through cookies based on the user history and location. But the ChatGPT, the session-based without long-term tracking, it does not track your search after end of the session. For the data privacy, the Google collect extensive user data for personalization and ads. However, the ChatGPT does not retain personal data post-session. However, it may share your data with others to train the model. And this is very important because, as we mentioned regarding the privacy of the patients, the ChatGPT can share any data that you put in the prompt and use it as a training for model. The purpose for the Google is to provide links and direct answer from the web. But the purpose of the ChatGPT to assist, analyze, compare, give insight, engage in conversation. The interaction of the style for the Google is provide link and structured data, while the interaction for the ChatGPT it provide text-based response in conversation format. So if you don't have the ChatGPT 4 and you need to search the internet using artificial intelligence, you can use what's called Copilot, the Edge browser of the Microsoft. You will go to the Edge browser of the Microsoft and click on this icon. You will get the Copilot, which is a chat GPT based, and you start search in this box to get the real-time search for ChatGPT. If you don't have ChatGPT 4. The other important thing, because the research idea can be shared with the ChatGPT, keep in mind that your idea can be shared with others to train the model, and you may not want to share your search idea with others. How can we overcome this part? Simply, we can change the setting to avoid the data from model training. So we will go to our account, then we'll go to the setting, then in the setting, we'll go to the data control, and then shut off the improve the model for everyone to train. You need to shut off this before you put your research idea in context to avoid using this with others and to train the model. How can the ChatGPT help me in writing the introduction of my idea? First of all, how the introduction should be ideally written. The introduction act by the first, we start by what's known information about the subject. Then we'll start by what is the unknown information of the subject or the gap in the knowledge. The third part, what is the aim of the work? So this is what's called the funnel shaped of the introduction for any introduction. What is the known and what is the unknown, then the aim or the objective of the study. So first, so if we want to start the writing introduction, we need to write the first draft in the introduction as outlined that meet the introduction structure. We need to write the first draft by our own, meeting the structure of the introduction. So, for example, if we want to have a study about the preception, what's the known information? Diagnostic biomarker is important tool to diagnose sepsis. Several biomarkers are available. Each one has its own limitation. Preception is a new biomarker. Preception is used as a diagnostic and prognostic tool. This is the known information. What is unknown information? None of the published study provide data in the use of the preception in neutropenic patients. So your study actually focus on the neutropenic patients. What is the aim of the study? The aim is to test the diagnostic accuracy in neutropenic patient. You just put your idea in a bullet format, meeting the structure of the introduction. What is the known, what is the unknown, and what is the aim? Then we will start by using the prompt for in ChatGPT and tell him, I'm writing a scientific medical research and I want you to write the introduction session based on the bullet points. Provide your response in 2 to 3 paragraphs. Do not exceed 500 words. Provide reference for each mentioned statement. So you give the ChatGPT the pathway that he will start to modulate these bullet points into the paragraph, but you have to write this bullet point as structured as or as outlined in the introduction section. So if you go to this prompt, we'll start by the ChatGPT starting by for rewriting this bullet point in a paragraph. Sepsis is a life-threatening condition that arises from the body response. Early accurate diagnosis is crucial for improving patient outcome. Diagnostic biomarkers have become an essential tool in identifying sepsis. However, each biomarker for sepsis comes with its own set limitation. Traditional biomarkers like C-reactive protein and procalcitonin has been widely used, but their specificity and sensitivity are often inadequate. And he mentioned two references. Then he start by writing something about the preception. The preception is a soluble CD14 subtypes, and studies have shown that the preception correlate with the severity of the sepsis, making it a valuable marker for all this is what's known information. Then we start by putting the gap. Despite this growing use, there is a notable gap. This is very important to mention the gap in your introduction in the literature regarding the application in specific patient population. Neutropenic patients are particularly vulnerable to infection due to their compromised immune system. Then we'll end the introduction with the aim of the study? The aim of the study to evaluate the accuracy perception in neutropenic patient by focus on the specific group which seek to fill the significant gap. Here is how the ChatGPT write the introduction as recommended by our bullet point meeting the outline of the introduction. Keep in mind that ChatGPT can plagiarize, but so my responsibility as a researcher is to check and edit. He can do a plagiarism. The second thing, the ChatGPT can hallucinate, can fabricate some data. So my responsibility is check for the facts that he posted as a reference. Is this reference is correct or not? This is very important when you take some suggestion or text from some, especially medical text from the ChatGPT. It can plagiarize and it can hallucinate. The second thing, I need the ChatGPT to help me in writing the method. The first thing, the method need to have this component, the study design, the sampling or population, the measurement, and the data collection. So I start by putting the prompt, write the method section based on this bullet point according to the structure typically used by journal. If you, for example, you type the name of the journal that you want to have the method section, the outline as or the format as suggested by this type of journal. I used here the Annals of Intensive Care. Then I will start by posting the essential points for the methodology. Study design is a prospective cohort study. Population, all patients admitted to ICU from the June 2024 to Jan 2025 with sepsis diagnosis according to the sepsis 3 definition. Data measurement, measure the pre-sepsin level alongside the CRP procalcinonin at admission 24 hours and 72 hours. Then we posted how the pre-sepsin was measured. The pre-sepsin was measured by plasma bypass fast assay. The primary outcome is very important to mention. The primary outcome is the diagnostic accuracy and potential superiority of the pre-sepsin over the traditional biomarker. The second outcome is the mortality, ethical committee approval, and for statistical analysis, I don't know what is the ideal statistical analysis for this study design. But if you, we will see that according to this type of information, the ChatGPT can fill in the gap how the ideal statistical analysis for this type of the study. We'll first start by posting this prompt, and as we see here, this is the start by writing the study design, the population, the data measurement, the outcome of the patients, and ethical consideration. And interestingly, he will start to post the statistical analysis, despite that I don't mention the statistical analysis. But as we see here from the types of the study that we measured by marker to test the diagnostic accuracy, so he feel that this type of analysis should be done through the receiving operating curve and measuring area under the curve. So he can suggest the statistical analysis based on the data that in the methodology. I'm sorry. Suppose that we need to add some points for data measurement. So we will type in the prompts that add in data measurement this type of the data, like hemodynamic data and Apache score. So the ChatGPT will continue, will start by increasing or modifying this section of the data measurement by adding, in addition to the biomarkers, the hemodynamic data, including heart rate, blood pressure, and saturation, will record every 4 hours, and the Apache score will be recorded every day. So this is a methodology section. Can the ChatGPT help to in sample size calculation and statistical analysis? Here is if we ask the ChatGPT to, if you please calculate the sample size for this study. So he will start by analyzing the structure of the study and tell us the assumption that the ideal for sample size calculation, that will first of all we need that to identify the alpha level, the power of the study, expected sensitivity and specificity, prevalence of the sepsis, and expected effect size. This is the main component that I should fill in to get in the sample size for our study. And then he start by example for calculation. If we have, assuming that the expected sensitivity is 0.85, the expected sensitivity of traditional biomarker is 0.75, expected specificity of the pre-sepsis is zero point 0.8, and for other biomarkers is zero point 0.7, and the prevalence of the sepsis is 30%. Then it will use this assumption to calculate the the design the number of the sample size. And as we see here, that by providing these types of the numbers, the expected sample size will be 200 to 300. So he can calculate the sample size provided by you feed this the ChatGPT with the essential component for sample size calculation as it recommended by like these examples. Then we have some data about the studies, hypothetical data about the pre-sepsin, PCT, CRP, and sepsis. And we need to compare these three biomarkers as a diagnostic tool for sepsis. Then the prompt is the analyze the attached Excel sheet created row curve for pre-sepsin, PCT, and CRP. Sepsis is diagnosed when the number assigned equal to 1 and provide p-value and sensitivity and specificity for the three biomarker. And we attached this Excel sheet for the ChatGPT and asking him to analyze the Excel sheet. Then we start by grafting the area under the curve. Then we start by posting the sensitivity and specificity and the threshold for every biomarker as a diagnostic tool. And as we say here, and as we said, and when I repeat this result for statistical software like MidCalc, look to the receiving operating curve that calculated by the ChatGPT. The pre-sepsin is 1, area under the curve for PCT is 0.3, and for CRP is 0.64. And for MidCalc, when I entered the same data for the MidCalc, it gave me the same area under the curve for the three biomarkers. Lastly, we need the ChatGPT to help in writing the discussion. And to write the discussion, we need to understand the structure of the discussion as we mentioned for introduction. We said that before. The introduction is the funnel shape to know that what's the known information, what is the knowledge gap, and what is the hypothesis and aim of the study. And the introduction is typically the reverse of the discussion. We started by answer the question asked of the research question, possible mechanism and pathway, and compare with other data. What is the clinical implication? What is the strength and limitation? And what is the conclusion? This is typically the structure of the discussion that should we follow in any research articles. For example, the main finding of this study, the pre-sepsin is more accurate for sepsis diagnosis than PCT and CRP. This is our main finding. This is so we start by answering the research questions. Then the accuracy, we start by what is the clinical pathway for that, or what the clinical explanation for that. The accuracy of the pre-sepsin, because it depends on CD64, blah, blah, blah. Then we will start by posting what is who is with us or who is against us. Several study consistent with our finding, and however, other studies don't show the superiority of the pre-sepsin over PCT. And the limitation is that our study population was severe and admitted to the ICU and did not test milder form of the sepsis. And the conclusion that diagnostic accuracy of the pre-sepsin is exceeding PCT and CRP in septic patient admitted to the ICU. If we put all this in the prompt of the ChatGPT, write the discussion section based on this bullet point as mentioned in the structure of the discussion, and we start by posting this. If we look to this result, the main finding started by the main finding. The primary finding of our study is that pre-sepsin demonstrate greater superiority in diagnosing, and he can start to create some scientific sentences to fit in or complete our idea. Then we start by consistency with previous research. Our results align with the several study that reported superiority and so on, contradictory evidence, clinical implication, and limitation. But as we see here, there is no reference mentioned in the discussion section. So I will ask the ChatGPT to search the internet for the study with and against our finding. Then we start rewriting the discussion and then build some reference for study with or against us. This is how can we start the discussion with writing the discussion with the ChatGPT. But keep in mind again, you have to check all what is written by the ChatGPT. For example, in this reference, the PMG, that is one of the contradictory mentioned as a contradictory study, this reference is just a protocol for meta-analysis with no published findings. So this is a fake. This actually is not a reference it's just a protocol. So you have to check. This is your job. You need to check the plagiarism and the hallucination of the ChatGPT in every reference and every sentence that he created by his own. Last thing for the research, the ChatGPT can provide a major role in the editing as a proofreader. So especially if you are not native English language and you want to check your language for grammar, for punctuation, for building the sentence, the ChatGPT is a great proofreader. So the professional proofreader, the following prompt can be used for a proofreader. First, rewrite this content to enhance the sentence structure, solve incorrect punctuation error in this content, check this article for consistency in formatting and styling. We will take this example paragraph and we ask the ChatGPT, consider yourself as a professional proofreaders and edit the following paragraph to enhance the sentence structure, solve incorrect grammar and punctuation errors in this content. Then we'll post this again. The ChatGPT start to change or modifying the structure and language and adding some punctuation like this is not mentioned, is not written in the original paragraph. And if we look to this, actually the difference, this is the edited paragraph, and this is you can ask the ChatGPT to show you what is the change or the key change in the paragraph. So he tell you that the key change is the title adjustment, some subject verb agreement, sentence clarity, consistency, grammar, and punctuation. But keep in mind that you should not all suggestions may be applicable. Proofreading is iterative process. That's mean that you need to repeat asking the ChatGPT to improve the structure of the sentence. Use the ChatGPT as complementary tool to aid your proofreader, but supplement it with your judgment and final human review. This is very important when you are using the ChatGPT as a proofreader. And the final part of this lecture is how can the ChatGPT help me in the education. First of all, it can simplify complex concepts. Suppose that we need to understand the align gap. You can ask the ChatGPT explain the concept of the align gap like I'm 12 years old. If we put this sentence like that, you can get this response. The ChatGPT start by telling the align gap to the child 12 years old. Imagine you have a puzzle with two kinds of the pieces, the red piece and the blue pieces. You need to put the puzzle together and start to act without mentioning any type of equation or something like that to explain the concept of the align gap for a child 12 years old. Then we'll repeat the same things, but we'll ask explain the concept of the align gap to the medical students. And when we change the type of the student, the ChatGPT start by mentioning some equations of the align gap. So you can simplify the concept of the any concept, whenever the concept is very complicated, and ask the ChatGPT to simplify to child, to medical student, to professor or consultant, so he can change the complexity of the structures of this topic to meet the reader or the who will be the audience for this topic. The second thing, we can have some complicated image like that. This is a very complicated image. We can ask them provide simple explanation for the attached image about the pathophysiology of sepsis-associated coagulation disorder. And again, this can be used only for the ChatGPT 4, the source, because the ChatGPT 4 is the function for attachment of function attachment is available only for ChatGPT 4, not for ChatGPT 3.5. When I put this very complicated image, then he start to explain what is going on in this image. First, you start by the initial immune response, the monocyte, the coagulation activation, neutrophil response, platelet activation, and endothelial cellular functional microthrombus formation. So you can simplify any type of the complicated image into simple paragraph and bullet points. The third thing that we can use it for ChatGPT for education, you can create course timetable. For example, you ask the ChatGPT act like experienced education instructor. Craft timetable for medical student for regional anesthesia. It should cover title like anatomical consideration, upper limb, lower limb, trunk. Provide your response in the table form. So you ask first of all, the ChatGPT should play as an experienced education instruction. You have to create the timetable. Then this timetable is for medical student. This is the detailed of the course, and this is the outcome of the response. The response should be in the form of a table form. So when you put this prompt in this ChatGPT, start to act like week 1, Monday, Wednesday, Friday, and each one have some introduction, trunk, 2 hours, 3 hours, and so on and so forth. Of course, this is just a draft. You need to modify and adjust, but he can save a lot of time when you put your idea in a clear, precise direction to have a near complete form of the required response. The second thing, we can create questions in different forms for exam. For example, consider yourself as an expert in the field of the education. I want to create 3 MCQs question based on the best answer in the most recent surviving sepsis campaign guideline. Consider 1 question on fluid resuscitation, 1 question for vasopressor and antibiotic use. So I asked the ChatGPT to create 3 MCQ questions. And we ask this, when you put this prompt, so you start by 3 multiple MCQ. This is the first questions with answers, with the questions, and he will give you the best answers. Then start by the second questions, then best answer, then the third question, and the best answers. 1 for fluid, 1 for vasopressor, and 1 for antibiotics. And also we can create, we can change the type of the question. For example, we need to create 3 short answer, not MCQ. We need to create 3 short answer questions. So in the same topic. So we have in septic shock guideline. So it start by creating 3 questions, short answered question for septic shock guideline. And then I asked him, please provide a model answer. So he start by providing the model answer for each question. The third thing, that in the education, we can create a simulation for patient with septic shock. So it's not just for asking to give a question, but also to create some simulation if you using some simulator. For example, I asked them create a simulation on patient with septic shock, and they start by putting the patient scenario, name, age, medical history, and the simulation steps what is the initial steps, time zero, what would the student should do, antibiotic use, fluid resuscitation, and so on and so forth. So he can create any simulation for any types of patient scenario and just give him the details and the objective of this scenario to get the perfect response. Last thing that we can craft what's called case-based discussion for complementary exam. For example, it's a form of exam that we use in our department. So he can create what's called the case-based discussion and start by creating some question and best and key point for these answers. So what are the tips for the ChatGPT use? First of all, don't expect the perfect answer in the first try. This is very, very important. You should iterate conversation with the AI calls it is iterative interaction. Very, very important. You should interact with the AI simply the process for engaging with AI in the back and forth manner. Don't take the first response is the best response. You have to interact and you have to deliver your idea or objective in a clear way. Thinking the more the precise in my instruction, the more accurate is the response. This is very important. The fourth thing that try to give a lead examples in your prompt to make sure that the AI understand what is the exact task you need to do. This is very important tips for ChatGPT. ChatGPT is very strong in content creation, in summarization, in the statistics, but the ChatGPT is limited, keep in mind, and requires some expertise for judgment in health advice. So if you take the ChatGPT for this part, he is very strong in that. But if you ask the ChatGPT to suggest some medical advice, keep in mind that he can make mistakes and you have to have some expertise for adjustments. And for research, try to write the first draft. It should not be perfect, but consider the main skeleton of the writing introduction and discussion, as we mentioned before. Write the draft by yourself. Follow the instruction of how to write this part, like how to write the introduction, how to write a discussion, and put this bullet point for ChatGPT as a guide how we will lead the introduction and discussion. In methodology, you need to provide the ChatGPT with the description of the population design, of the measurement, of the outcome, and the ethical approval. And lastly, the ChatGPT is a very good in editing. You can use it as a proofreader. Thank you for your listening.
Recording stopped.
Here we have يعني متهيألي questions. طبعا الدكتورة دكتور أماني، دكتورة هبة، and دكتورة نورازي. دكتورة أماني, please go ahead.